Today's date's January 5th, 2017. We're here with Jerry. Jerry has a very significant problem for a man. He's got an enlarged prostate. It's over 50 grams with obstruction. You've had repeated urinary tract infections. You've had serious obstruction with your bladder holding 800 milliliters of fluid. Is that correct?
1,000.
Excuse me, 1,000. That's a lot. You know, usually we like to void between 500 and 600. And right now you have a catheter in your bladder.
Correct.
Right? It doesn't feel good, does it? What have the doctors done for you so far?
Give me pain medication to address the pain, the urethra. Put me on supplements. My naturopath helped reduce the size about 20% using supplements and exercise.
What's the urologist say?
Urologist said do a TERP, which is basically going and cutting around the urethra, and I didn't want to do surgery. That's why I came here.
Thank you. For the viewer, TERP means a transurethral prostate resection.
Right.
Where they go up through your urethra to the prostate and carve it away.
Exactly.
That releases the obstruction, but it can have other problems too, such as getting a stricture in your urethra and retrograde ejaculation and perhaps leakage too. So you came here because you didn't want that.
No.
Now, I didn't tell you not to get that, did I?
No.
All right. We're just trying to support you.
Right.
And we did some ozone on you.
Yes.
We first did a suprapubic injection here
Right.
of ozone, correct?
Correct.
And you got an ozone 10 pass,
Yes.
and you got some supplements.
Yes.
And I just saw you 2 days ago for the first time, correct?
That's correct.
What's happened to you then since?
After the second 10 pass, I had extreme discomfort because the tube is inside me moving, and I was taking Percocet for the pain, which worked, painkillers. After the second 10 pass, I went home, I slept, I was tired, I woke up feeling great. Last night and today, no pain pills necessary, and I can walk more normally instead of creeping along.
So that urethra, which is going up here, the catheter was causing a lot of local pain.
Yeah, the tube actually going into the penis and the urethra, just every time, it just wiggles every time you walk.
Right, and that was causing pain, and you were taking Percocet for that.
Right.
After 2 10 passes, that's gone.
Yeah.
What about the ozone injection that I did here? Did you notice anything from that?
No, not really.
Okay, that's all right. The 10 passes seem to have made a huge difference at
Yes.
this point.
Yes.
Okay. You know, my purpose in videoing this is to put it on YouTube. Is that
Yes,
okay with you?
That's fine.
Okay, I'm hoping it will help other men.
I hope so too. Yeah.
What are your thoughts at this point on everything you've experienced here?
Staff is great. You're great. I'm so glad I came here. I'm so glad I came. I drove all the way from Oregon to get here.
Oh my God.
It was worth the 7-hour drive. And just driving here, I was in extreme pain driving all the way down. I could barely concentrate to drive here.
And you're driving now, correct? Today.
Oh,
You
yeah.
drove today.
Yeah, I drove. Yeah, no pain.
No pain.
No pain. No pain. No pain. Slight discomfort. Slight discomfort.
I love it.
So it's gone from a 10 to a 0.5 right now.
Oh, jeez. That's fine. That's something you could even live with if you had to.
If I had to, yeah.
Yeah. Okay. Thank you so much for that. Incidentally, I just want you to know I have noticed in some people that there is a delayed effect when I do a pelvic injection. In other words, in some women with pelvic problems, when I do the injection, sometimes they get an immediate relief, and sometimes it might not be for a few days as it percolates through and does its thing. So I'm not willing to write off the fact that that suprapubic injection did nothing, because it was the following day after the second 10 pass you did great. It's still possible that that injection was of benefit to you.
Yeah.
Does that make sense?
Yes.
Okay. Thanks very much.
Thank you.
Another thing before you go, on Tuesday we had discussed actually injecting around your prostate from your perineum, from your bottom.
Correct.
And we chose to go suprapubic at first, and then I said we can always do the other one, but you're doing so much better now that we're going to forego an injection through your perineum towards your prostate.
Great.
Isn't that cool?
It is very cool.
Okay. I'm really happy about that.
I love the 10 pass. And the ultraviolet, I did the ultraviolet too, the
Oh,
knot
good.
machine. Yeah.
Okay, thanks.
Thank you.